Now to health matters. The Nigerian Medical Association in Jigawa State says more than 30 specialist doctors have left the state in just 4 months due to poor working conditions and uncompetitive salaries. Speaking at a news conference in Dutse, the NMA chairman, Dr. Usman Haruna, said the mass departure of medical professionals is putting the state's health system at serious risk. He said Jigawa State now has just one doctor for every 30,000 people, far below the World Health Organization's recommendation of 1 to 600. He blamed the situation on the failure to implement a salary review earlier approved by Governor Umar Namadi. Well, let's now speak with our reporter in Jigawa State, Yusuf Isa, for more on this. Yusuf, one doctor to every 30,000 people is a lot of deficits from the WHO's recommendation of 1 to 600. Help us better understand the situation in Jigawa State.
So good afternoon. I didn't hear you well, but the root of the current stand-up lies in an unfulfilled salary review directives. And in February 2025, following a consultations with the health union, Governor Umar Namadi approved a directive mandating the state's minimum wage implementation committee to meet with NMA and review doctors' salary and report within 2 weeks. So the mandate include aligning salary structure with and implementing hazard allowance, reviewing a call duty compensations. But however, 5 months on, the NMA said the committee has neither completed its engagement nor submitted any reports to the governor. So the association wants that without immediate government intervention, Jigawa could face a further brain drain of specialists and also collapse of service in general and rural hospitals, then increase of burden on few remaining doctors, then widen public health consequences, especially in underserved communities. So according to NMA, the balls, according to them, is now in the governor's court. The union is urging him to take decisive action to by compelling the salary committee to submit its recommendations without delay.
And have we heard just yet, from the governor or from his team about their reaction to this demand being made by the NMA in Jigawa State?
Yes, despite heavy investment in infrastructure and staffing, Jigawa continued to operate far below the WHO's doctor-to-patient benchmark, making it one of Nigerian most understaffed states in medical care. Despite government initiatives, hospital upgraded and PHCs revitalized a large-scale pre-healthcare program, launched dual impacts of underfunding and low doctor retention threatened to undermine these gains. In 2023, Jigawa has hired about 3,000 healthcare workers, spent 9.7 billion to upgrade 114 PHCs, and it also launched pre-healthcare for 143,000 vulnerable people under popular Jigawa J Health. So these are initiatives that the current administration of Governor Umar Namadi come up with in order to upgrade the healthcare system in the state. But this issue of brain drain and also the issue of doctor-to-patient ratio, as raised by the NMA, is a kind of issue that is continue threatening all the development, all the achievements.
All right, Yusuf, but I'm also scared, this coming at this time, I really do hope the doctors are not planning to embark on strike. Yusuf Issa for us in Dutse, Jigawa State. Thank you very much. Well, let's bring in Ayodeji Muradeo. He joins us from Korea, also on this issue of mass exodus of health professionals. Ayodeji, from what you're hearing, how bad is the situation in Ondo State? What is the statistics on the exodus of health professionals? Ayodeji, from what you're hearing, how bad is the situation in Ondo State with doctors' exodus? We'll be back with Ayodeji when we were able to fix that. Moving on now.